Welcome to our presentation on Betty Neuman for NU 601 Nursing Theory course. Betty Neuman was born near Lowell, Ohio. Here she grew up on a farm with her older and younger brother. Betty's father was sick while she was growing up, between ages 6 and 11. During this time, Betty assisted in taking care of her father by completing small favors. She noted that this taught her responsibility. Additionally, Betty's mother was a midwife, and she recalled stealing her doctor books to read in bed. Her watching her mother work as a midwife influenced her decision to go into nursing. Betty originally attended a one-room schoolhouse that both her mother and father attended when they were young. Eventually, Betty switched schools and graduated from Marietta High School. During her time in high school, she was very involved in the orchestra and the choir, and upon graduation, she took a job as an aircraft instrument technician. She would help with installing and repairing instruments in fighter planes, and she felt she was making a difference in the war effort. Betty noted that this job was to save money so that she could attend nursing school in the future. In 1947, she went on to attend a 2.5-year accelerated nursing program in Akron, Ohio. Betty described this program as very strict. She said that respect played a huge role in her learning, and she was expected to open elevator doors and give her place in line to doctors or other upperclassmen. If she did not, she would have been reported and lost privileges in the nursing program. Following her graduation from nursing school, Betty went on to hold a variety of clinical roles. Since the war was over following her training, she was not required to join the service, but rather went to work for the Los Angeles County General Hospital. In addition to this job, Betty held a role as a school nurse and an industrial nurse. Aside from nursing, Betty was also working as a fashion model and learned how to fly. In 1959, Betty had her first and only daughter named Nancy. She recalled that Nancy was extremely intelligent, with an 150-word vocabulary at just 18 months old. Later in life, Nancy went on to become a licensed marriage family counselor and also worked as an actress. In 1966, Betty went back to obtain her Master's of Science in Mental Health from UCLA. 6 months after she completed this program, she acquired the chair position of the program that she graduated from. She went on to develop this position into a mental health program for post-grad students at the School of Nursing in LA. Betty recalls taking students out into the emerging mental health centers in LA. In 1970, the program Betty created was the first mental health program on the West Coast. Students reported that Betty consistently had a positive attitude and had a way of making difficult things feel simple. In 1970, Betty designed a teaching tool at the request of her graduate students to create an overview course that would provide knowledge on client variables. Betty recalled designing the model at home and then bringing it to a planning group, which consisted of faculty who were planning to teach the graduate students. From here, they approved of the use of it for integrative purposes. Betty and her co-coordinator Ray G. Young decided to evaluate the use of the design and publish the results. At this point in time, she still thought of it as a teaching tool rather than a conceptual model. In 1974, Joan Reel invited Betty to co-author the first nursing models book. However, she was planning a permanent move to the East Coast during that time, so she recommended her classmate, Sister Roy. In that published book, they classified Betty's tool as a systems model. An assessment intervention tool was also added in this 1974 publication so that the tool could be utilized more easily. In 1982, Betty published her first book, The Neuman Systems Model, Application to Nursing Education and Practice. This book outlined the nursing process format and included how the Neuman Systems Model applied to individuals, families, and the community for a patient-centered care approach. In 1985, Betty graduated from Pacific Western University with a doctoral degree in clinical psychology. In 1988, at the second biannual Neuman Systems Symposium, the Neuman System Model Trustee Group was formed. Betty personally chose 22 individuals who had utilized the model and understood it. These 22 individuals would facilitate the use of the model in the future of nursing through preserving its integrity and promoting new directions. In 1995, the second edition of the Neuman Systems Model book was published. This new edition contained an additional variable, the spiritual. This is the newest variable identified, creating 5 total variables. Betty noted that many schools already acknowledge the spiritual component through the social cultural variable. However, Betty wanted it to be explicit. She blamed that teaching at a secular school is most likely the reason she did not include it in her original book. However, she believes that the spirit is an important aspect of man that needs to be considered. The second edition also expanded on the concept of environment by including created environment. Shortly after the second edition was published, a third edition of the book came out. This edition included chapters on culture, international use of the model, applications to administration, and the construction of conceptual theoretical structures for research. In 2002, the fourth edition of the Neuman Systems Model book was published. This book was co-edited by Betty Neuman and Jacqueline Fawcett. The new edition mentioned guidelines for clinical practice, model-based research, education, and administration. In 2010, the fifth edition of the Neuman Systems Model book was published, and it was co-edited by Betty Neuman and Jacqueline Fawcett. The latest edition included chapters to expand the client system as an individual, family, group, and community. Middle-range theory development and integrative theorizing was included in this edition as well. In 2012, Betty was honored by the Walsh University Spires School of Nursing with the Distinguished Service Medal for her outstanding service in the nursing profession. In 2022, Betty Neuman passed away, surrounded by loved ones, at age 97. This line contains Betty Neuman's obituary from the Marietta Times. In this obituary, Betty Neuman is referred to as Betty Dicklish. She was a native of Watertown, Ohio, and she passed away in Seattle, Washington. In this obituary, they discuss her prior achievements and her profound impact that she had on nursing as a whole. It includes that she is survived by her daughter, Nancy Neuman, and her grandson, Gabriel Neuman, both of Seattle, Washington. She was also survived by a niece, a nephew, and her deceased husband, Cree Dicklish.
As mentioned above, Betty grew up in rural Ohio on a farm. Her mother was a self-taught midwife, her father a farmer. Her father passed away of chronic kidney disease, which was largely untreated due to accessibility to specialized care where she lived. She grew up during the Great Depression era. Rural families in this time, like hers, had very little cushion for illness or crises. This taught her to be resourceful and practical. When she graduated high school, she began working in the wartime aircraft industry before joining the Cadet Nurse Corps in 1944. World War II created a spectacular need for nurses and pulled women like Betty in as a result. While researching Betty Neuman and the foundation for which her theory was built, themes seemed to jump out at me. It's evident that from all the way back to Nightingale to the mid-20th century, nursing was never viewed as an autonomous job, always viewed as an extension of medicine or doctors' helpers. Feminism and Newman's system model intersect because they both challenged that patriarchal medical hierarchy. When nurse leaders began writing and exploring these theories, they really opened the door as to the direction nursing needed to go. Describing nursing as its own entity, separate to medicine, and having the system recognize that was the stepping stones for what nursing is today. By the late 1960s, Betty was teaching at UCLA right as American mental health care was shifting from asylums towards community-based preventative care. The 1963 Community Mental Health Centers Act was a landmark piece of that shift. In 1970, frustrated that traditional medical model wasn't giving her students a broad enough lens, Betty sketched an early teaching tool that became the direct ancestor of her systems model. And all of this happened alongside nursing's professionalization movement and, again, the second wave of feminism, which gave nursing theorists like her both the motivation and the intellectual room to build something. that had authoritative and independent standing. Betty Neuman did not come up with her theory from scratch. There was not enough information in nursing at the time for her to build a research base. So instead, she borrowed the information from other areas. Number one, systems. The general systems theory that believes that the client is an open system. This comes from biologist Ludwig von Bertalanffy and philosopher Ervin Laszlo. They believed living things were as open systems, constantly exchanging energy and information with their environment while seeking dynamic balance. This is where the client is an open system comes from. Number two, stress theory. The body's response to stress. This theory came from endocrinologist Heinz Selle, who defined stress as the body's nonspecific response to any demand. This gives Neuman the concept of the quote unquote stressor, any tension producing force, positive or negative. Number three, coping, how people react and respond to that stress. This came from psychologist Richard Lazarus, who added the idea of appraisal. How a person interprets a stressor shapes the actual impact, which explains why identical stressors affect different client systems very differently. Number four, prevention. Primary, secondary, and tertiary levels of prevention and intervention. This came from psychiatrist Gerald Kaplan. Primary prevention before a stressor invades, secondary once it's already has invaded a system, and tertiary afterwards to support the reconstitution. Lastly, wholeness. Gestalt theory, looking at the person as a whole, not just as a diagnosis. This came from the philosophies of wholeness, Desjardins, Cornu, and Kurt Lewin's field theory. The conviction that a living being only makes sense as an integrated whole. This is the whole philosophical whole behind Newman's insistence on looking at the physiological, psychological, sociocultural, developmental, and spiritual variabilities of a client altogether, and not just simply their diagnosis. As I mentioned, Betty Neuman did not invent von Bertalanffy's systems theory, Selle's stress theory, or Kaplan's prevention levels. She did, however, take what she had, synthesize them, looked through her own experiences in nursing and her own story, and turned them into a model. Her personal history, including caring for her father while he was dying and watching her mother be a midwife, gave her the holistic prevention first instinct that drives the entire philosophy of the model. The systems theory gave her the actual architecture. The client is an open system. There is lines of resistance and lines of defense within that system. Selle and Lazarus gave her the concept of a stressor, so understanding that one stressor can look different for you as it does for me. Kaplan's level of prevention gave her the practical intervention framework for her model. And the philosophers of wholeness gave her the conviction that you have to look at all of the variables together, as mentioned, psychological, physiological, sociocultural, developmental, and spiritual, to get a good picture of the whole entire system.
The Neuman systems model utilizes a system approach focused on human needs of protection or relief of stress. Neuman emphasized the need for human dynamic balance between patient and nurse to identify problems, mutually agree on goals, and use prevention as an intervention. This directly correlates with consensual validation and its importance with patient-centered care and patient outcomes. Nursing and other healthcare providers should practice to promote increased communication and understanding at the bedside and assist in understanding treatment plans, which in turn helps patient outcomes. So here we see the meta-paradigm relationships. The Neuman systems model shows the nurse, health, patient, environment are all variables that function together to attain, maintain, and or retain system stability. This model is based on the patient's reaction to stressors. The nurse's major concern is to maintain patient system stability through assessments, environmental checks, and other stressors while assisting to adjust to those changes and maintain wellness. Health, defined as a continuum, where health and wellness are at opposing ends, and health is optimal system stability. These variances in wellness are caused by stressors or stressor invasion. The patient or client system is of physiological, psychological, sociocultural, developmental, and spiritual interacting variables. The environment are three concentric rings that represent internal, external, and created, which all influence a patient's adaptation to stressors. And this is shown in the diagram above on the slide. Neuman delineated a three-step nursing process. Here we have a list that has all of the concepts that are associated in Neuman's systems model. This three-step nursing process, the first step in the nursing diagnosis is the collect data and analyze variances from wellness to make diagnoses. The second step is where nursing goals are determined by negotiating with the patient. Nursing outcomes is the third step. This is where confirmation of changes or reformulation of goals is evaluated. Here, the nurse links all the meta-paradigm variables that were previously mentioned, and then this feeds back into the system as applicable. As we know, this is similar to Maslow's hierarchy of needs, and that a patient or individual cannot move on to the next step of care without prior acceptance from the last step. This is a major psychology theory that involves more internal gratification and self-fulfillment and motivation of needs. These two systems, as different as they seem, work holistically by helping maintain current wellness level by offering protection from additional stressors and addressing other aspects of physiology, psychology, spirituality, socioculture, and development. To Neumann, the environment is a structure that we previously showed on a prior slide that has the concentric rings. According to Neuman, the major nursing concern is to maintain client stability through assessing environmental stressors and assisting in the adjustments that are needed to maintain stability. The concepts in this model include degree of reaction to stressors, the stressors themselves, as well as the basic structural components to the model, and of course, the feedback from variables.
Now, let's talk about the usefulness of Neumann Sissel's model in nursing practice. One of the greatest strengths of Neumann system models is a holistic approach. Instead of viewing the patient only through a lens of a medical diagnosis, the model encourages nurses to assess the entire person. This includes the 5 variables: physiological, psychological, sociocultural, developmental, and spiritual. Looking at all 5 areas helps nurses understand how different stressors influence a patient's overall health and well-being. The model is built on several theoretical foundations. General systems theory views the patient as an open system that is constantly interacting with the environment. Stress theory helps nurses recognize how internal and external factors can threaten a patient's stability. Coping theory reminds us that every patient responds differently to stress depending on their available resources and support systems. Prevention theory provides the framework for primary, secondary, and tertiary interventions, while Gestalt's theory reinforces the importance of caring for the whole person rather than treating the symptom itself. Because of these principles, Neumann system models is applicable in many healthcare settings, including acute care, pediatric, oncology, mental health, rehab, community health, nursing, education, and leadership. It provides nurses with flexible framework for delivering individualized patient care while promoting wellness and preventing illness. Now we have a made-up patient case of a 60-year-old male who is presenting with acute exacerbation of heart failure. Using Neumann's model, we're able to assess the patient thoroughly in practice. In terms of Gestalt theory, physiologically, the patient is experiencing shortness of breath, edema, fatigue, fluid overload. Psychologically, they're anxious. Socioculturally, we could say that they live alone or has family or perhaps has limited family support. Developmentally, they adjust to challenges associating with ages and their chronic disease. Spiritually, he can rely on prayer and any other emotional services that can be provided to them. In terms of stressors, we can identify that there's multiple stressors that can affect the patient. Interpersonal stressors include his heart failure, fatigue. Interpersonal stressors include limited family support, while extra personal stressors include financial concerns and transportation barriers. For prevention, a guide to nursing intervention, primary prevention includes patient education, medication, teaching, and dietary counseling before discharge. Secondary prevention focuses on treating the acute illness throughout oxygen therapy, IV diuretics, cardiac monitoring, and as a tertiary prevention, it emphasizes rehabilitation, home health, home health services, follow up, and prevent future hospitalizations. Now, using general systems theory, we view the patient as an open system that constantly interacts with internal and external environments. This reminds us that nurses that change in one area of the patient's life can affect the stability of the entire system. Therefore, it is important for nurses to prevent any other infection that reaches the patient. When it comes to coping, encouraging nurses to assess how the patient responds to these stressors. In this case, we would evaluate the patient's coping strategies, emotional responses, available support systems, and ability to manage chronic illness after discharge. As we apply all of this into theory, we're able to see that patients are often viewed as an open system that interacts with the whole environment. We assess for emotional resilience and abilities to support systems, addresses all 5 variables rather than only treating heart failure. In terms of applying all of this into theory, we are able to see that patient is viewed as an open system that interacts with the environment. We're able to assess the emotional resilience that the patient inhibits and provide support as they need. We're also able to see the patient through the 5 variables rather than just treating the illnesses alone, as they are interconnected. Addressing only the patient's heart failure will overlook their psychological, social, and spiritual needs, and also influence recovery by considering the patient as a whole. Nurses can provide more holistic and individualized care. Another important part is testability, which refers to the theory can be applied and evaluated in clinical practice and research. To illustrate this, I chose a recent article by Van Orr published in 2024. The purpose of this article was to demonstrate how Neuman's system model can improve transitions in care for children in medical complexity, moving from the ICU to a general med-surg unit. The author uses the Neuman system model to guide nursing assessment by identifying internal and external stressors, evaluating the child's physiological, psychological, sociological, developmental, and spiritual needs, and implementing prevention-focused nursing interventions. The article found that better communication between healthcare providers, standardized handoffs, medication reconciliation, and proactive planning may reduce stress during transition and can improve patient stability. These interventions reflect Newman's emphasis on prevention and maintaining system stability. Although this publication is a conceptual application rather than an experimental research, it demonstrates that Newman's system model can be translated into real clinical practice and provides a framework for future research evaluating patients' outcomes. Next is parsimony. The Neuman system models combine ideas from general systems theory, stress theory, coping theory, prevention theory, and Gestalt theory into one comprehensive nursing framework. While it gives the model tremendous flexibility, it also makes it more complex than many other nursing theories. One strength is that all the concepts are logically connected, that patient is viewed as an open system, stressors threaten system stability, coping mechanisms influence adaptability, prevention guides nursing interventions, and holistic care supports overall wellness. However, because there are many interacting concepts such as the lines of defense, lines of resistance, stressors, prevention levels, and 5 client variables, the theory can initially overwhelm, especially for novice nurses. Overall, the Neuman system model is considered moderately complex, but its logical organization allows nurses to apply it effectively across diverse patient populations and healthcare settings. In value of nursing, the Neuman system model has made a significant contribution to nursing science and continues to influence nursing education, research, and clinical practice. One example is the theory of unpleasant symptoms developed by Lentz and their colleagues in 1997. This middle range theory builds upon Neuman's holistic perspective by examining how physiological, psychological, and situational factors influence symptoms, experiences, and patients' performance. Like the Neuman system model, the theory of unpleasant symptoms recognizes that the multiple factors interact to affect health outcomes and emphasize individualized nursing care. More broadly, the Neuman system model has expanded nursing by integrating principles from general system theory, stress theory, coping theory, prevention theory, and gut-scale theory into comprehensive framework. These concepts continue to guide nursing criteria, advanced practice, evidence-based research, and holistic patient care. Therefore, the Neuman system model remains one of the most influential grand nursing theories because of its emphasis on prevention, stress management, adaptation, and the person as a whole. Through this presentation, we've explored Betty Neuman's life, the historical events that shaped her thinking, and the philosophical foundations that influenced the development of the Neuman system model. We discuss how general systems theory, stress theory, coping theory, prevention theory, and gut-scale theory came together to create a model that views patients as dynamic, open systems interacting with their environment. We also reviewed the major concepts of the theory, including the metapathogens, stressors, lines of defense, and prevention as intervention. Finally, we evaluated the theory's usefulness, testability, parsimony, and contribution to nursing. Overall, the Neuman system model remains one of the most influential grand nursing theory because it provides nursing with a holistic prevention-focused framework that can be applied across many healthcare settings. It reminds us that nursing is more than treating a disease. It's about understanding the whole person, recognizing many stressors that affect health, and using prevention to promote stability, adaptation, and better understanding of the patient and outcomes.